It is the voice of Indiana County, WCCS 101.1 FM AM 1160, and this is Indiana in the Morning, presented by First Commonwealth Bank. And it's time now for another interview segment presented by Marcus & Mack, a law firm representing injured people. As we've heard in prior interviews on Indiana in the Morning, the coronavirus situation, especially the cancellation of activities, has had a negative effect on a lot of people. And for some, like athletes, even student athletes, that effect can be devastating. Joining us this morning on Indiana in the Morning is Tim McGuine, a sports medicine researcher at the University of Wisconsin School of Medicine and Public Health. Tim, thanks very much for joining us today.
Thank you. Thank you for having me.
Well, let's introduce our listeners to you. Talk about some of your past work that you've done with the University of Wisconsin.
Well, as you said, I'm a sports medicine researcher. So I've been doing this for 25 years or so. And a lot of what we've been doing is trying to look at better ways to keep kids healthy and active. We've done the largest studies in the world on preventing ankle sprains, looking at how knee injuries affect kids. We've done the largest study in the world on preventing concussions in soccer players. And in a lot of these studies, we would enroll 2,000 or 3,000 kids at a time and follow them for a year or more and seeing how it's going. Over the last decade or so, though, there's been a greater realization that sports aren't just sports, and I firmly believe that these are actual activities that can really benefit these kids beyond simply throwing a baseball or shooting a basketball. For example, we know that high school athletes have better health than their non-athlete peers. They have lower levels of stress and anxiety. They're more physically fit. They have a higher quality of life, and that's not in the short term. We know that's in the long term as well. For example, we know that kids that play high school sports as they go to adulthood are more likely to stay in school, they're more likely to graduate, less likely to use drugs or smoke. We know that as adults, they're more likely to be civically and socially engaged, they're more likely to have a meaningful career, and they're more likely to stay active as adults. So with that in mind, I've always had the perspective that these aren't just sports issues, these are quality of life, these are public health issues, that the more we can keep kids healthy and active at a young age, the better they do in the short term, but the better we do as a society in the long term. Mm-hmm. So that's been some of my focus for the last 10 years.
As you know, here in Pennsylvania, Governor Tom Wolf recently moved the goalposts, pardon the pun, on schools across the Commonwealth, strongly recommending shutting down high school sports until January 1st. This after our sports governing body, the PIAA, had approved a comprehensive safe return to play plan. And you recently did a story on the impact of school closures and sports cancellations on the health of adolescent athletes. We heard a little bit of the inspiration behind that. Maybe you could go into more, and also the results of that study.
So what, again, we've been doing, or as I mentioned, looking at how athletics are a public health issue. So for the last decade or so, we've been measuring, for example, the quality of life of kids, and we've always now included those measures. So we try to measure how these kids are doing mentally, physically, for all of our studies. When the schools shut down here in Wisconsin, it was an interesting situation. I don't know what it was like specifically in Pennsylvania, but our governor announced a short-term, 2-week stop, catch our breath. Let's make sure our medical providers are up and running. Let's make sure we're prepared to deal with this. And they had news about infection rates, et cetera. And 10 days later, it was automatically extended. Hey, we're going to go for another 2 weeks, but don't worry, we're still going to try to get back. We're going to try to get back to school. We're not canceling school. We're not canceling sports. These shutdowns and school closures are short term, and we're going to move forward. And the numbers actually improved quite a bit. And literally 10 to 12 days later, it was like, hey, by the way, we're done with everything. And this took a lot of people by surprise because, people are socially distancing, people are staying home, a lot of businesses closed, and the hospitals were not being overrun, and suddenly, bam, the schools were closed. And for a lot of people, for many, many people, this is quite a shock. And the parents I spoke with who had kids still in high school said they were just devastated. Mm-hmm. Said that their kids were looking forward to going back to school, graduating if they could, playing their sports. And suddenly it was taken away. So we said, with that in mind, what could we do? So we put together a study very quickly to go ahead and try to measure how these kids are doing mentally, physically, and looking at their quality of life. And the idea is we would collect this data online. We would get the word out that we were collecting data. Kids could go on and log into our study. They could complete a survey that took approximately 6 minutes and provide some information about the county where they lived, the sports they played, the grade level, et cetera. And then what we did was we took the data we collected this spring in May and compared it to our previous data for the past 2 or 3 years on how high school athletes are doing in the state of Wisconsin. And so we collected data on 3,000 kids. Now we compared it to 5,000 kids we had data on in the last several years. And to be honest, the results were very, very striking, very surprising, and concerning.
Talk about some of those results.
Well, for example, one of the things we found was that the mental health issues, measures of anxiety and depression skyrocketed. We would see a small level of anxiety or depression in kids, high school kids generally, and you can blame it on a number of factors. Some people have said there's been increasing over the years because of social media pressures or other aspects of these kids' life. It's why these kids were having levels of depression. But in athletes, it was always lower. We would expect to see, 5 to 10% of these kids expressing some level of concern or answering questions that would make us be concerned about them being depressed. Well, those numbers went up to 2/3 of the cases. So we went from 10, 20%, in some cases 30% of the kids expressing some level of depression, went up to 66 to 70%.
Wow.
Off the charts. And when those numbers came in, I looked at that, and I'm not a child psychiatrist, but I work with a child psychiatrist who's on a research team who we both looked at the numbers, and her comment to me was, that can't be right. Let's check again. And we checked again. Our statistician went through everything again. We did the numbers, and she said she'd never seen anything like that before, that 2/3 of these kids would be expressing some level of depression that would require some sort of medical intervention. She said if somebody came into my office or people refer patients to me, when we ask these questions, when they score this high, we're like, you need to go ahead and get some assistance. That was very, very concerning. Mm-hmm. Physical activity was down by 50%. And the quality of life score, which is scored on a scale of 0 to 100, the quality of life was lower than we'd ever seen. It's lower than normal athletes. It's normal than kids that are dealing with injuries such as concussions or significant knee injuries. The only comparable scores we could look to see comparable scores were kids with childhood cancer. So that was surprising as well. So the mental health, the physical activity, and overall quality of life were just off the charts, very, very low.
We live in an area where there are still a lot of broadband issues, and that's really hurt e-learning and set children back. Even those who were successful with the virtual learning, what would your concerns be with starting the new school year in a similar fashion?
Well, it's tough. Virtual learning can only do so much. There's still the socialization aspect of schools and sports is so important. And, it's hard to I guess, redo that or duplicate that in a virtual environment. Mm-hmm. How can you get that level of interaction? My wife was a speech therapist for 35 years, and she said with the special needs kids she's worked with, et cetera, she said it'd be virtually impossible to do some of those things in a virtual environment. The other thing I think we need to understand, too, is that what you're expressing in Pennsylvania is what we saw in northern Wisconsin, where I had school district administrators pleading to be allowed to keep school in session in the spring, mm-hmm. and are pleading to make it go forward in the fall, because they're saying kids literally had to get in a car and ride for 25 minutes to get to a Wi-Fi hotspot. 30% of the kids had no access to a computer, tablet, or a phone or laptop at home where they could do this work. So it's just a myriad of events that makes it very difficult to do. And I should also say something that when I'm talking to our psychiatrist, she said, Tim, you have to understand, too, that if a kid or if parents come to me or they can get referred to me, I understand that. We can go ahead and get some intervention. For the poor kids, the kids without means, the single parents, households, where they do not have financial resources to get private medical attention, that mental health intervention is usually performed at the school through the counselors, through the teachers, through the coaches. And that's taken away in that virtual environment.
Regarding sports, how important is the correlation between physical activity and mental health?
We think it is. It's very important. They're not two different entities. One of the aspects, or one of the things we do most often when kids are struggling with depression or anxiety is some of the interventions that we use most often are exercise and organized sports. So if we see some kids struggling or some people, young people doing this, we like to get them involved in activities and sports because that can help alleviate some of those symptoms. And so we've got almost a triple threat of a problem here. We had this pandemic come through where we would have, economic uncertainty. We would have this general anxiety overall about the disease and how bad it was and people dying in nursing homes, et cetera. And then we pile on that. We take away a school and sports, which would go ahead and help alleviate some of those problems in these kids. So it's like there. And then it's like add on to the fact that if we're not getting physically active, we're making everything worse. We're just making things a lot worse down the road as well.
Is it possible to reverse these symptoms by simply adding physical activity back in?
It's hard to say. Physical activity is something we saw, again, in our injury cases where we studied kids with a concussion or a knee injury. Their physical activity scores go low, but then they respond quite well as they get back to their sport. If we're shutting down playgrounds and sport opportunities, though, for months at a time, we can assume that that's not going to come back anytime soon. And that's going to linger. And as a child psychiatrist was telling me, she said, Tim, these aren't one-offs. This is not something that, hey, suddenly we can open up the parks and the schools and get kids playing. We're going to see the lingering effects of these issues for a long time, decades in some cases.
What about the competition factor? Students have a competitive spirit. Student athletes will have a competitive spirit, and in some cases, that may need to be fed too. Is physical exercise enough, or would student athletes need actual competition?
Well, that's a good question, and can we tease that out? It's hard to say. What's just physical activity? What is school-related? What is competitive sports? We did look a little bit of that in our data. We divided the kids up in our study. And I should say this right now. We had 3,000 data points from Wisconsin. We have 13,000 kids responded to our survey nationwide. So looking at our total data, kids from Pennsylvania and Ohio and Indiana and New York, we found the same patterns that we saw in Wisconsin in terms of lower quality of life, depression. Can we increase that with competitive sports as opposed to just being physically active? I would think so, because as you mentioned, there are some different aspects. There's one thing to go out for a walk or hike by myself. Mm-hmm. That's a different level of intervention and a different level of social interaction than being on a team and having a team goal, winning or losing as a team, counting on your teammates, having your teammates count on you, working toward a common end of the season opportunities. You can't duplicate that by saying, hey, just go out for a walk, go for a hike. We did look at some scores because some people said, how much of this is just related to school closings, and how do you know it's sport related? Well, we did look at the kids that participate in sports like golf or tennis or running, because in Wisconsin you could still do those things. Initially they were shut down for a week, but by the middle of May, golf courses were open, tennis courts were open, and you could obviously go out for a run. Those kids had much higher quality of life, had lower mental health, had fewer mental health issues, and more physical activity scores. They were higher than the kids that were the team sport athletes. So the baseball, softball, the volleyball, the club basketball players that we told everything was worse for those kids as opposed to the kids that could just do some physical activity.
All right. I want to ask you this and turn back the clock and contrast COVID-19 with two other deadly diseases. I mean, there are others, but these two come to mind. Measles killed millions of children prior to a vaccine in 1963, and it is still a threat. And in 1968, the Hong Kong flu pandemic, which was caused by H3N2 virus that caused over 1 million deaths and over 100,000 in the United States. Yet life went on. Schools didn't close, and sports continued to be played. What makes coronavirus different from, say, those two?
I'm not a virologist or immunologist, but to me, that's been a very good question from day one. I understand this is a deadly disease. I don't want to minimize that, but I also understand that this idea, but we responded in a way as a society and schools and our culture has never really been done, and to this broad extent. I mean, you look at the Center for Disease Control; they talked about school closures being anything more than 2 weeks could cause anxiety. I don't think the CDC was anticipating closing schools for 6-7 months at a time. And again, if you look at the numbers from the 1968-69 flu pandemic, it's very comparable to what we're seeing now in terms of total deaths and hospitalizations in the U.S. and worldwide. I'm always concerned anytime we do a large intervention is I think public health experts, politicians need to let us know if we do this intervention, what are the unintended consequences? Because there are huge unintended consequences for going ahead and doing this. I was reading reports how they talked about could you control a pandemic by mass closures and things. And 15 years ago, this was unheard of. Public policy experts said the social upheaval would be too great, that the people wouldn't stand for their civil liberties and schools being disrupted in such a way to go ahead and do this. But we did it.
Mm-hmm.
I don't know. I'm waiting for somebody to tell me that. I know it's new because viruses mutate, but I'm still trying to find somebody. You show me how we're better doing what we're doing now than how we dealt with this before.
One last question. What advice do you have for schools, parents, students, student athletes, and the many stakeholders that would play a role in shaping their future?
Well, like I said, let's be consistent. If we're a politician or a health expert and say we're guided by the numbers and we have to listen to science, then listen to the science. And have the honesty to listen to the science whether you want to do it or not. If the science says kids are better in school, then let them go to school. If the science says the unintended consequences of not playing sports are worse than letting the small risk of contracting the disease by playing their sports, let's go ahead and let them do that. I think policy experts, school officials, parents, I think we can get through this. I think there's a way forward. I think we can protect our most vulnerable people in our communities, in our schools, in our hospitals, and still let kids play soccer and still let kids get on a baseball field. I'm confident with some creative solutions we can go ahead and work towards those goals to get the benefit for these kids to get forward and get active and still keep people safe that are vulnerable.
Tim McGuine is a sports medicine researcher at the University of Wisconsin School of Medicine and Public Health. Tim, we are out of time. Thank you very much for joining us and for talking about this very important topic here on Indiana in the Morning.
Thank you. Thank you for having me.
All right. Again, Tim McGuine with the sports medicine researcher at the University of Wisconsin School of Medicine and Public Health, joining us on Indiana in the Morning, presented by First Commonwealth.